So today we're going to be taping the arch. Most often we'll tape the arch for 2 or 3 reasons really. The first one, a patient presents with a pes planus foot posture, which means they have a flat foot and they need support. They might be a hyperpronator, which means they're spending a lot of time here stretching out that arch, and so they need arch support. Or they might have medial tibial stress syndrome, and so we want to tape the arch to support the tibia. Those are the 3 major reasons that we probably would use an arch tape job. Just like with any good tape job, we're going to spray the foot down, make it really, really sticky, let that dry. And then the next thing that we want to do is we want to use our 1.5 inch tape to create an anchor point. And that anchor point, you guys, is going to go across the metatarsal head. So if you feel the plantar surface of your own foot, you'll feel, if you palpate deep enough, these kind of marble-like structures. Those are your metatarsal heads. That's where we want that anchor point to live. So we're going to create an anchor point, and then what we're going to do is create these teardrop-like tape sequences. So we're going to start on the first metatarsal here, and what we're going to do is wrap around the calcaneus and then come back up to that first metatarsal. Okay? See that? So why is it called a teardrop? Because if you've ever cried or if you've ever watched a raindrop fall from the sky, it looks like you see this teardrop here. Our second teardrop is going to start right at that second metatarsal head, and essentially what we're doing is half lapping the first teardrop. You can imagine our third teardrop is going to go over that third metatarsal head, and again we're going to half lap and we're going to tear off right over that third metatarsal head. So we always end where we began. Fourth teardrop is going to go over the fourth metatarsal head and end over the fourth metatarsal head. And the trickiest of teardrops is the fifth metatarsal head, and we're going to end at the fifth metatarsal head. So when you're done, you should have something that looks like this, right? Once we have this done, then the next thing that we always do as clinicians is we're going to close off with C-clamp. So we're going to start at the distal calcaneus, and we're going to pull from lateral to medial. The intent of this is to, again, pull up on that medial longitudinal arch to support it. And again, half lap. So I'm pulling up on that arch to support it. Pulling up on that arch to support it. And then we'll finish off on the top. Now, one thing that I like to do, because what I find when athletes put their feet in socks, right? The tape will roll. So one way to prevent that is to use some stretchy tape to close off your tape job. So we'll start here and we'll use that stretchy tape to wrap around. And again, it's not tight. We don't want it too tight. If it's too tight, the foot will start to cramp. And that is what is called a teardrop arch tape job.